All right, so let's talk about some causes of respiratory acidosis. So, what you want to know about respiratory acidosis, the biggest takeaway is going to be respiratory depression. So, what happens during respiratory depressions? That your respirations are slowed down, right? So, do we know why our respiratory rate is slowed down in there? So, and why that patient is acidotic? So, when our respiration slow down, we're going to be holding on to all that CO2, right? All that CO2 then starts to bind with water, and then it starts to make all these hydrogen ions. So, what are some things that can cause respiratory acidosis? So, medications such as our opioids, such as fentanyl, morphine, any type of sedative, like Verse said, any type of medication that causes drowsiness and all that kind of stuff, that can cause respiratory depression. Also diseases that cause weakness of voluntary muscles that affect the diaphragm, such as if this patient has myasthenia gravis, Guillain-Barré syndrome, any type of neuromuscular disease. If this patient also has pneumonia, if this patient has COPD, if this patient has asthma. So anything that can affect that patient's respiratory status, where that patient is not able to maintain, a normal respiratory rate, if this patient is not able to give proper gas exchange, if this patient has decreased gas exchange, restricted airflow, these are going to be these disease processes that can cause this patient to experience respiratory acidosis. So, how is this patient going to look experiencing respiratory acidosis? So, this patient is going to experience neuro changes. Why? Because they're not getting enough oxygen to the brain. So, this patient may be confused. They may be drowsy. They may even complain of a headache. You're going to see low oxygen rate on their pulse ox. You will see that their respiration rate is less than 12. This patient is going to have an increased heart rate. The heart is going to speed up to try to compensate and to get more oxygen. That patient will have hypotension, and that patient will have increased carbon dioxide levels. So think about it. This patient is holding on to that CO2. So, what are we going to do for this patient experiencing respiratory acidosis? Number one, we're going to treat the cause. So, if the cause is pneumonia, we want to treat that. If the cause is asthma, we want to treat that. If the cause is that we gave that patient too much fentanyl, we want to treat that. So, we want to administer oxygen. We want to monitor the respiratory and neuro changes that the patient is having. We want to give bronchodilators to open up the bronchioles, right, to allow improved air oxygenation. We want to hold medications that cause respiratory depression, and that patient may need to be intubated if the CO2 is severely elevated. And then we want to monitor the patient's potassium levels, because during acidosis, remember, during acidosis, this causes the potassium to move outside of the cell into the bloodstream. So we want to keep our eye on all of that. All right, so what is happening in respiratory alkalosis? So with alkalosis, we have our blood pH is going to be greater than 7.5. Our carbon dioxide levels is going to be less than 35. And to compensate for this, the kidneys start to excrete bicarb. So what causes respiratory alkalosis? That's going to be hyperventilation, so excessive respiration. So this patient is going to be expelling too much carbon dioxide, right? So if we are expelling all that carbon dioxide is not being able to mix with water to make these hydrogen ions and stuff like that. So that this patient is going to be very basic. So you will see that your patient may be hyperventilating. Temperature increases such as fever due to increased metabolic needs of the body, which causes the respiratory center to try to compensate by making the respiratory rate increase. You will also see this in patients where aspirin toxicity. This also can be caused by controlled ventilation. So mechanical ventilation, the settings could be set too fast, and this hyper ventilates the patient with too much oxygen and depletes your carbon dioxide. If your patient is experiencing anxiety, they're going to start to hyperventilate, right? So anxiety is a big one that you will see in respiratory alkalosis. Also, ascending in altitude. So low oxygen level causes the body to hyperventilate. So these are some causes of respiratory alkalosis. So the biggest takeaway is going to be hyperventilation. So what is this patient going to look like? This patient is going to be tachypnic. They're going to have fast respirations. You're going to see neural changes in this patient as well. Confusion, anxiety, fear, dizziness, and even could be as serious as seizures. The patient is going to have an elevated heart rate, and you may also see hypocalcemia and hypokalemia signs and symptoms in this patient. So remember how alkalosis goes with your potassium. So those are two things that you want to keep in mind when you're dealing with alkalosis patients. So what are we going to do? So number one, we always want to treat the cause of why this patient is experiencing this type of imbalance. But we can use a rebreather mask or a paper bag to slow down the breathing. So you could give a patient a brown paper bag and have them take some slow breaths inside that bag. All right. So we also want to make sure that we're monitoring our electrolytes. So know the signs and symptoms of a low potassium and a low calcium. And we know one of the biggest things is that this patient maybe needs to be monitored on the cardiac monitor, because low potassium can lead to EKG changes. So you want to administer sedatives or anti-anxiety medications to reduce anxiety and to decrease hyperventilations. And you want to teach the patient relax techniques and methods to manage stress and prevent escalation. So the biggest thing with respiratory alkalosis is that this patient is going to be breathing really, really fast, and our interventions want to be targeted to decreasing and slowing those respirations.
All right, so let's practice some ABGs. I know y'all are tired of me talking, so let's practice some ABGs.
All right, so the pH is 7.35, which is normal. Our CO2 is 49, which is elevated, so that is acidosis. Our bicarb is 30, which is elevated, which is alkalosis. So we're going to look at our chart to see, do we have two under the same column? And we don't. So we need to assess and see what's going on. So we're going to have to look at our pH. So is our pH on the acidosis side of normal or the alkalosis side of normal? So your little cheat sheet says that if the pH is less than 7.40, then it's going to be on the acidosis side. So we're going to move our pH to the acidosis side. All right. So now we have our pH and our CO2 under the acidosis. So our patient is experiencing respiratory acidosis, but there is some type of compensation going on because our bicarb is not normal. So how do we find out what type of compensation is going on? In this problem, we're going to look at the pH. Being that the pH is normal, this patient is experiencing full compensation. So the answer is respiratory acidosis with full compensation. So we know anytime that the pH is normal, there is going to be full compensation. All right, so the pH is 7.31. So the pH is low. So we're going to put that under the acidosis side. And then our CO2 is 49, so that is high. So we're going to put that under the acidosis side as well. And then our bicarb is 30, which is high as well. And we're going to put that on the alkalosis side, because if the bicarb is greater than 26, it's going to be considered alkalosis. So we then want to look and see, do we have any two under the same column? And the answer is yes. We have the pH and the CO2. So the answer is respiratory acidosis, partially compensated. Why is it partially compensated? Because the bicarb is out of whack